My name is Nirav Shah, and I am the director of the State of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrew and I are delighted to be able to be with everyone this afternoon to provide an update on where we stand with COVID-19 for the state of Maine for today, Thursday, November 12th, 2020. I'll start by providing a synopsis of where we are from a public health and epidemiological perspective, and then turn it over to Commissioner Lambrew for some updates on new developments. I begin today's update on some sad notes. In the recent 48 hours, Maine CDC has recorded the deaths of 3 additional individuals with COVID-19. Yesterday, we were made aware of 2 deaths, one in a man in his 80s from Knox County, and another in a woman in her 70s from Waldo County. Today, we were made aware of yet another death, that in a man in his 70s from Androscoggin County. These 3 deaths collectively mark the 157th, 158th, and 159th deaths associated with COVID-19 in Maine. I'd like to take a moment to offer the friends, family, and communities of all 3 of these individuals our deepest condolences during this time of grief right now. Overall, statewide, there are a total of 8,396 total cases of COVID-19, an increase of 194 cases since yesterday. Of those, 7,516 are confirmed cases, and 880 are probable cases. As I mentioned a moment ago, we've now logged 159 deaths across the state, quite sadly, since we started our activation. 553 people have been hospitalized cumulatively, and right now in the state, 62 people are hospitalized with COVID-19, 16 of whom are in the intensive care unit, and 6 of whom are on ventilators. That comes to a rate of hospitalization of 4.6 people hospitalized for every 100,000 Mainers. To put that number in perspective, the national average is 13 hospitalizations for every 100,000 people. But keep in mind that just a few weeks ago, our rate in Maine was 0.5 or 1. We've seen a significant increase in hospitalizations, particularly among those in intensive care units, just in the past few weeks alone. Overall, 6,275 individuals have recovered, and among our cases are 1,311 healthcare workers. To zoom back a notch, of the cases reported to Maine CDC yesterday, 20% of them are among individuals who hail from Androscoggin County, 17% are from Cumberland County, and 16% are from York County. This pattern of high numbers of cases day upon day is one that is obviously concerning to us. And for me, it serves as a call to action for everyone who's watching today. Now more than ever, doing things like wearing a face covering and maintaining physical distance are more important than they've ever been. Consistently, every single day now, we are recording cases across most counties in Maine in zip codes and areas where there were previously few. The virus is here. It is all around us, and it is spreading with ferocity. I'd like to take a second to talk now about some recent outbreak investigations that Maine CDC has opened. I'd like to divide them into 2 groups. The first category are two sets of outbreaks that we have recently opened in restaurants in Maine. Just today, we opened an investigation into Jay's Oysters over in Portland, where we detected COVID-19 among 5 staff members. We've also opened an epidemiological investigation into Willow's Restaurant in South Portland, where we've detected COVID-19 among 7 staff members. We've also, just in the past 24 hours, opened outbreak investigations into several different community settings in Western Maine. For example, we've opened an outbreak investigation into 3 cases of COVID-19 connected with the Androscoggin County Jail. We've also opened an investigation into the Community Concepts Childcare, where we've detected 3 cases among staff members. We've also opened an investigation into the Guy Rowe School, where we've detected 4 cases, 2 among students and 2 among staff. Similarly, we've opened an investigation into the Maine Nordiques hockey team, where we found a total of 3 cases, 1 among a student, 2 among staff members. And finally, at the Oxford Hills High School, where we've detected a total of 5 cases. Now, these are 5 outbreak investigations that we have opened just in the past 24 hours, all of which are in the Western Maine area. Again, yet another reminder that the virus is everywhere among us. In places where it was previously spreading in low levels, we have now found it to be spreading in very high levels. And those clusters, those low levels of seeding that we saw in the past week or two, are now generating outbreaks, even in places where there were previously few. That's just 5 outbreaks that I've mentioned in the past 24, 36 hours that we've opened up in a part of the state where there were previously few. Before I turn things over to Commissioner Lambrew, I'd like to take a second to talk a little bit about something you may have seen in the national news. This is a new therapy that will soon be coming to Maine. A few days ago, the United States Food and Drug Administration authorized on an emergency basis the use of a new type of drug for the treatment of COVID-19. This is a drug that falls into a category of drugs called monoclonal antibodies. This is a category of drugs that are derived from people who have already had an experience with COVID-19 to take the antibodies, those disease-fighting molecules that are amongst all of us, figure out which ones are effective against COVID-19, and then synthesize them in a lab. Just a few days ago, Maine CDC was notified by the federal government that the US FDA had approved a new therapy of this monoclonal antibody sort manufactured by a large company, Eli Lilly. We were not only notified that the drug had been approved, but that Maine, as well as the other states, would be receiving an allocation of this drug that goes by a long name called bamlanivimab. We would be receiving approximately 90 doses of that drug every week for the next several months. We at the Maine CDC started working with hospital systems across the state and healthcare providers to make sure they were aware and up to date that this drug had recently been authorized and that it would soon be coming. We're not quite sure when it will arrive, but we understand that it may arrive in the coming days. Now, I wanted to mention this to everybody for a few reasons. The first is, again, you may have seen on the news, on the national news, that this drug had just been authorized. And I wanted everybody to know that this new cutting-edge therapy was on its way to Maine. But I also wanted to talk about this drug as a way to manage the expectations around it. This is a brand new drug. And right now, what we know about it is based on one study. And what that study documented was that the drug seems to be the most effective in a rather narrow group of people, not individuals who have already been hospitalized, which the drug remdesivir, a drug that we talked about a couple of months ago, that drug is used for people who have already been hospitalized. This drug is used in folks who may become hospitalized in an effort to prevent them from having to be put into the hospital. That holds promise for us, given where we are and what we've been seeing with increasing hospitalization rates. But it also poses challenges for the clinical community. Identifying the patients who are the most likely to benefit from this drug will be something of a clinical challenge. But we have been working with hospitals and healthcare providers to think through which patients might benefit from this drug the most. The other thing I wanted to mention is what this drug is used for. As I mentioned a moment ago, the primary function of this drug is to try to keep folks out of the hospital so they can be cared for and recover from COVID in their own home rather than needing to be hospitalized. The data are not yet in about whether there might be other benefits, for example, around the percentage of people who may not need a ventilator or who may survive. Those data are still being generated. I think the bottom line for me is that this drug is not a panacea. It's not a silver bullet, but it is yet another tool that we at the state level can work together in partnership with healthcare providers and hospitals to make sure that everybody in Maine can take advantage of if they meet the qualifications. The final note on that is as follows. Although this is a good drug and one that we welcome, the doses right now are limited. As I mentioned a moment ago, Maine will only be receiving approximately 90 doses. That's because nationwide, production of the drug is just starting to ramp up. So while we welcome it, this is not a drug that is appropriate for everybody because of the tight clinical characteristics. It may also be one that providers may assign for certain folks because of their possibility of being hospitalized given other pre-existing health conditions they've made. We'll have more updates from everybody after the drug arrives and as we are distributing it to healthcare systems. So with that, let me just take a second now to provide a couple of updates on where we are with respect to testing. Right now, the positivity rate across the state of Maine for PCR tests stands at 2.47%. That's about what it was yesterday as well. To put that number in perspective, the national average for positivity rate stands at about 6%. In terms of testing volume, our testing volume right now in Maine for PCR tests stands at 606 tests for every 100,000 people. To put that number in perspective, the national testing volume stands at about 363 tests for every 100,000 people. Our rate in Maine stands at 606 per 100,000. One final milestone that I wanted to take a moment to recognize. In the past 48 hours, the Maine CDC's Public Health Emergency Preparedness Program delivered its 3 millionth piece of PPE to healthcare providers across the state of Maine. We started delivering PPE to healthcare providers, first responders, and other healthcare institutions weeks before we had even our first case of COVID-19 in the state. And even though I don't talk about PPE deliveries in the same way that I did back in March and April, we haven't slowed down one bit. We are still continuing to ship out PPE to first responders and healthcare providers across the state, and we haven't slowed that effort down whatsoever. Again, I wanted to take a second to thank not just healthcare providers and first responders in the state, but to take a second to give a shout out to our public health emergency preparedness team. 3 million pieces of PPE being delivered across the state is one of the reasons that we've been able to keep healthcare providers on the job, taking care of every single person in Maine who has been affected by COVID-19, as well as those who haven't. So big thanks to the Public Health Emergency Preparedness team. With that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. The Maine Department of Health and Human Services is pleased to announce that beginning tomorrow, Walgreens will provide Abbott's Buy Next Now rapid antigen point-of-care test at 10 sites from Sanford to Calais. About 65 sites are expected to be operational by November 23rd. The tests are available to Maine people at no charge. The Buy Next Now test can help people with symptoms of COVID-19 take steps to protect themselves and those around them as we continue our fight against this virus. The Buy Next Now test has been authorized by the U.S. Food and Drug Administration for testing symptomatic individuals with COVID-19 within the first 7 days of symptoms. The Buy Next Now test may also be used in limited circumstances to serially test certain critical infrastructure staff who are identified to be close contacts of individuals confirmed to have COVID-19. Initially, this includes first responders, healthcare workers, and educational staff. Rapid antigen COVID-19 testing will be available at Walgreens by appointments to adults and children aged 3 and over. Appointments can be made by following the steps on walgreens.com/COVID-19 testing. People will self-collect a sample with a nasal swab under the supervision of Walgreens staff and submit the sample through the drive-through window, with the results available in as little as an hour. Testing is available through the department's partnership with Walgreens to administer up to 300,000 antigen tests. In total, Maine is receiving 400,000 Buy Next Now tests. The department is separately allocating 100,000 tests through an application process. It will prioritize facilities that serve high-risk populations, high-risk settings, and other settings where access to testing is otherwise limited. While Buy Next Now rapid antigen tests is best used for people experiencing symptoms of COVID-19, other types of testing is available in Maine to people who think they need a test regardless of symptoms and without the need for a referral from a healthcare provider. This testing is available at more than 24 swab and send sites throughout the state that offer molecular testing at no charge. For more information, visit the Keep Maine Healthy website. Maine's testing capacity is among the best in the nation, with our testing volume 3.5 times higher than our target, according to independent experts. This new tool will help us hopefully slow the spread of COVID-19 in Maine. With that, I'll turn it back over to Dr. Shah for questions.
Great. Thanks, Commissioner. We will take some questions from our colleagues in the media. Excuse me, the first question for the afternoon goes to Rebecca Stefanski from News Center.
Hi, Dr. Shah, Commissioner Lambrew. Thank you for taking questions. I have a couple of questions about hospitalizations and then something entirely different. According to the CDC website, which it looks like was just updated today, there are 105 critical care beds available across the state. As hospitalizations are increasing, especially those with critical care, as you've outlined, how far are we from a tipping point where beds simply aren't available like we're seeing in other states? And are any preparations similar to what was done early in the pandemic, like the Cross Insurance Center and Arena being revisited? And also, as a sidebar to that, a US CDC report that was published says that they're seeing some patients that require readmittance to the hospital and ongoing clinical care. And are any individuals here in Maine experiencing that? And where does that put us for the hospitalizations?
Okay, let me take certain parts of that and then have the commissioner as well weigh in. So let's start with just in general the landscape around hospitalizations. Rebecca, we're concerned about where things are going with respect to hospitalizations, and Commissioner and I will lay out some of the steps we've been taking. But it's also important to differentiate where things stand right now from a clinical and hospitalization perspective of COVID from where they were back in March. We've talked about at these meetings that patients who are diagnosed with COVID right now need not be hospitalized and are not being hospitalized at the same rates they were earlier in the pandemic. The fact that our numbers are climbing is suggestive that there is just so much more transmission happening. But another thing that has changed is where patients can be hospitalized. Earlier in the pandemic, in Maine as well as across the country, patients were largely being transferred and referred to larger tertiary care centers for hospitalization. But given the clinical experience that's been accrued, patients are now being able to be cared for in community settings in their own neighborhoods, towns, counties. That means that we've got much more capacity, in quotes, than we did before because we have that many more beds available at community settings. The other thing that's important, Rebecca, that's not really captured in that 105 is the number of beds that can be converted to ICUs if the demand arises. We've been working with healthcare systems to start thinking about how many beds within their facilities could become intensive care unit beds if the need arises. The other thing that I'll mention is in connection with your last question around readmittance. That has been a concern nationwide. We have seen some readmittance in Maine, not anything out of the ordinary relative to the nationwide numbers. We've been in line with where other states are. This is a really important reminder though, because I talk about recovered cases. And what I'm talking about when I talk about recovered is simply someone who no longer meets the criteria to have active COVID-19 disease. But that doesn't mean for a second that their bout with COVID-19 is over. We have talked and seen in the national media as well as in Maine, individuals whose symptoms may persist for a long time and who may have longstanding health consequences from COVID, as well as in some cases needing to be readmitted. So that is definitely a risk. and it's one that the scientific community is just now being able to characterize more. But we have taken concrete steps to make sure we're ready, and I'll turn that over to the commissioner.
Sure. I'll only add that we had and still have and are continuing to refine plans for alternative care sites. Those plans are fully detailed. They are ready to go on days' notice as needed. We are not close to those triggers for needing alternative care sites. As Dr. Shah said, we do see a dispersion of hospitalization now compared to the spring, which gives us some more of that room for capacity. All that said, we take this very seriously. We see what's going on in the rest of the country, and we will be ready as needed.
Rebecca, I don't want to go too far into the weeds, but this is another important point. Although it's important to think about the number of beds, we've also got to think about staff as well, which is another piece of the entire ability to deliver good care to people who are critically ill.
Okay, and that actually leads to my next question, which is on a slightly different topic, but people and resources and contact tracers. It's been reported in other states that contact tracers simply can't keep up with what they've been doing prior, asking detailed questions and following the path. And at this point, in many cases, are simply calling and saying, you may have been exposed, please call and tell your friends. Where are we? I believe maybe it was last week, something about the 200 number being where we might have a tipping point, but that's not gospel. But where are we with our contact tracers? And is that still a reasonable method to try and contain outbreaks or community transmission?
Okay, so your latter question is a very important one that I'll get to. Let me first provide what the numbers are. The 200 number, I just want to dispel that was not a tipping point, and if I don't recall saying that, but if I did, that was not something that that I've endorsed. The way we've approached contact tracing and case investigation is with so many other things in COVID. It's a dial. And as the number of cases has increased, we have continually and commensurately turned up the dial. Just earlier this week, we redeployed approximately 25 staff within the Maine CDC who had previously been trained to work as contact tracers and investigators. We've redeployed them to our existing force of people. And so that force now stands roughly at about 125 people. But make no mistake, we are also taking steps to train more people from within the agency, as well as other employees who have shown an interest in wanting to serve in that capacity. We're preparing to keep turning up the dial as the number of cases continues to rise. The latter question you asked is a good one, and it's a hard one, which is what is the role of contact tracing given what we are seeing with community transmission? I've had an opportunity to discuss that with my colleagues across the country as recently as 2 nights ago. And we still believe that the strategy of offering widespread testing, which as Commissioner Lambrew noted, we have taken even more significant steps to do just today in partnership with Walgreens. The strategy of widespread testing coupled with case investigation and contact tracing to let folks know that they could have been exposed and that they need to quarantine, we still believe that has value. We're not pulling away from that. Indeed, we're turning up the dial even more. I'm going to turn now to Allison Ross at WMTW.
Hi, thank you so much for taking my question. So Dr. Shah, my first question is for you. So I'm not sure if you're aware of this new term. It's kind of been circulating. It's COVID-19 PTSD. We're hearing reports of people recovering from the virus, but then having lasting mental health issues. Now, is this something that the Maine CDC is aware of, and are you doing anything right now to address this?
I too have heard that term and have discussed it with some colleagues of mine. I personally know somebody who was affected by COVID about 2.5 months ago, 3 months ago, and as a result is now very fearful of going out of doors. And it's a similar phenomenon. And I think for me, Allison, this is all the more reason why it's important that we remain connected, both with folks in our communities who have not yet or have not been affected by COVID, but who may be at risk, but as well as folks who we know who have been affected. If you know somebody who's been affected by COVID, pick up the phone, call them, text them, check in with them, because that anguish that can persist and the fear that being stricken by what can be for many people a very difficult disease, that doesn't go away. So we're also working with our colleagues across the department to think about COVID in a more holistic way. And I'll let the commissioner discuss that.
Yeah, we have a program called Strengthen Me, as in Strengthen Maine, that is all about providing professional, peer, and other types of supports for people of all different ages. We recognize the strain of COVID-19, both for those who have it, as well as for their family members and people who are fearful of it. So we really urge people to look up Strengthen Me, call 211. If you're on the front lines or a teacher, we have our frontline warm line. We strive to ensure that anybody who is feeling mental anxiety or depression or other symptoms of mental health disorders to reach out.
Great. And then I just have
go ahead,
other
Allison.
questions. Sorry. It's just about hockey. So I was wondering if maybe Dr. Shah or Commissioner Lambrew could just explain. So we're getting a lot of questions as to why hockey would be considered such a kind of dangerous sport in terms of spreading the virus compared to other sports, like, for example, basketball.
So here in Maine, we have our community sports checklist, which applies to all sports that are not professional, not collegiate level sports. And we categorize sports in 3 different categories: lower, moderate, and higher risk sports. We treat all moderate risk sports, that includes ice hockey, lacrosse, field hockey, basketball, the same. So we do have one set of guidance for all moderate risk sports, the same with higher risk sports. Last Friday, we did update that guidance in light of evidence about what we're learning, especially as we're moving sports from outdoors to indoors, to basically, for moderate and higher level risk sports, to take a break. We are encouraged, we changed the activity level. So level 1 activity, skills and drills for moderate and higher risk sports should begin no earlier than December 7th. Practices, scrimmages, internal kind of intra-team activities can begin on December 14th, and competition will begin after January 11th. So that's our guidance that we put out last Friday. We do believe that taking this kind of break for these 3 to 4 weeks will allow us to hopefully get COVID-19 under control. I would note that Dr. Shah just mentioned we did have an outbreak at a hockey team, in a hockey team declared yesterday. The state of New Jersey had 14 hockey outbreaks. Hockey has proven to be a high-risk sport, but here in Maine, we treat it the same as other moderate-risk sports. And I will note that we are not alone in this. Governor Mills joined New England plus New Jersey agreement, a regional compact, to suspend interstate hockey until the new year for similar reasons. But again, we treat all moderate-risk sports the same.
Thank you.
I'm going to turn next to Ann Burwian from the Ellsworth American.
Thank you, Dr. Shah. I have a couple of questions about an outbreak in Ellsworth and recent cases on Mount Desert Island. In Ellsworth, I wondered if you could update me on the status of a recent outbreak at Kids Peace. It was started out as 3 on Friday, and now it was up to 17 yesterday. So my question is there another update on that outbreak? And do you know if anyone among them is symptomatic?
The numbers at the Kids Peace outbreak still remain at 17 as of right now. And we are continuing to work with them to determine whether further rounds of testing are needed. So there'll be more updates on that. In terms of the percentage of individuals there who are symptomatic, we can check and see with the outbreak investigator what that number is and see if we can get that to you.
Thank you. And then my second question is, there's been a handful of cases in and around the Bar Harbor area, and it's prompted 7 restaurants to temporarily close because there was a direct contact by one employee with someone positive with COVID. Since the transmission doesn't appear to be linked to any particular establishment, first, are you aware of any event in Bar Harbor that might have contributed to this? And if not, does that mean community transmission is on Mount Desert Island?
So I'm not aware of any particular event. And I want to be really, really clear. Community transmission is all across Maine. It's not just on MDI. It's not just in your county. It's not just in your neighbor's county. It's not just in your uncle's county. It is every single place across Maine.
Great. Thank
It
you.
varies with intensity. Some places are having more transmission than others, but it's in every zip code, every county, every corner of the state.
Great. Thank you so much, Dr. Shah.
You bet. Going to turn next to Dan Newman at the Beacon.
Thanks a lot. I actually have two questions, if you'll allow me. First, can you say if and how the CDC is preparing for another outbreak among unhoused people, particularly as the season changes and people are forced indoors? Is there anything new being done to track potential outbreaks in that community and preparing municipalities?
Sure, Dan, I'll start and Commissioner can chime in as well. This has been a concern for us. So we've been starting to prepare for the colder weather for all of us, not just across the state. We know that individuals will be utilizing shelters for people experiencing homelessness, particularly, as you said, amongst the unhoused. One of the things that we've done very recently is to make sure that shelters for people experiencing homelessness are equipped with some of the rapid testing, so that when individuals come to use those shelters, if they're experiencing symptoms or if they develop symptoms while they're there, they can be rapidly tested and we can get a quick look at what's going on and know what immediate steps to take. If someone's just got a cold, that's one thing. But if they happen to test positive for COVID-19, we've got a plan in place working with our team on the social services side to provide them everything that they would need to be able to isolate safely. So that's something that we've been doing, but now as we get into colder months, the advent of these more rapid tests will allow us to make these decisions much more quickly and help folks get into isolation that much more quickly.
We continue our work with the Maine State Housing Authority to identify appropriate COVID-safe types of shelters for the winter months, just knowing that the options that we had available in the summer are no longer there. So that work is ongoing. We do regular conversations with the municipalities to make sure that we also provide the ongoing behavioral health and other types of supports that those types of shelters need to make sure that those people stay safe, not just from COVID-19, but from other health and behavioral health challenges.
Thanks. So there's an outbreak at the Maine Correctional Center, 2 infected staff at Long Creek Juvenile Detention Center, now an outbreak in Auburn Jail, in addition to what we saw at York County. Has the administration rethought its position on universal testing in all incarceration facilities? Previously, the Department of Correction resisted only testing when there's outbreak or symptomatic people. Despite calls from advocates from the very beginning, way back in April. Is this something that's being reconsidered?
You know, what I'll tell you there is we have followed the US CDC's guidelines with respect to any type of congregate living setting, or in this case, centers of incarceration. We followed the US CDC guidelines, and from an epidemiological perspective, I don't see that we're going to be departing from those. I'm going to turn now to Jay Mishkin at WGME.
Thank you very much. I guess I just probably have a quick question. What's our current thinking about, as people are going to be traveling back home, certainly students and things like that, people who are recovered patients and their ability to transmit the virus? So if someone had the virus in October and recovered and is now traveling back home, could they be a carrier, and are they considered someone that we need to be careful of?
We don't know the answer. Based on everything that we have seen thus far, it does not appear that someone who has recovered from COVID can be an unknowing carrier of the virus and potentially infect others in their household. But that is different from saying with definition that it can't happen. I've not seen any data to suggest that it can, but again, that's not the same as saying it absolutely can't. When someone has recovered, that is to say they've met the US CDC's definition for no longer having active COVID-19 disease. We generally think that that means they've built up immunity so that their risk of being reinfected is low. There have been one or two instances where folks have been, but they're the rarity. But the question that you raise is whether someone could unknowingly allow themselves to have the virus hitch a ride with them. It doesn't appear to be. The reason I say that is that if the numbers of individuals who have been affected by COVID were such that those individuals were serving as carriers, the patterns of transmission that we would see would look a lot different. We would see a lot more household cases even after somebody has been found to have recovered from COVID. But we don't see that. That's an encouraging sign. Is it a possibility? Yes, but it seems to be an unlikely one. A very unlikely one, I would say.
But I do think it's a good time to remind people of our travel policy here in Maine. We have, from the start of the pandemic, had some rules related to traveling to and from places where COVID-19 is prevalent. That includes when you do come back to Maine or come to Maine for the first time, you should quarantine for 14 days. You can test as an alternative to that, having that sample taken within 72 hours of your arrival in Maine. And while we have currently 3 states that are exempt from that policy, Massachusetts, New Hampshire, and Vermont, we're looking very closely at what's going on in Massachusetts because we are concerned that they've seen a rapid rise in COVID-19 in Massachusetts. So as a reminder, we have testing that's available here in the state of Maine. If you're traveling to and from a place with higher COVID-19 than here, you should quarantine or test in any case, but especially if you're coming from all but those 3 states.
I'm going to turn to Patty White at Maine Public next.
Thanks, Dr. Shah. I've got a question about the monoclonal antibodies. If we're getting 90 doses per week, how many patients per week would that treat? I don't know how many doses each patient gets.
The math on this one's easy. 1 vial is 1 dose is 1 patient. So 90 doses per week is 90 patients per week.
Okay, great. And then I've got a question.
And sorry, Patty, it's a one-time administration. So it takes about 1 hour to infuse the drug. And then the patient is recommended to be monitored for an hour just to make sure they're doing okay. So it's not a pill, it's an infusion that takes about 1 hour.
Okay, and you were saying it's hard to figure out which patients should get these, but generally speaking, it would be patients with underlying conditions?
Yes. So the answer to your latter question is yes. It is, and we're working with clinicians in Maine to develop a series or a set of guidelines that will help other clinicians in Maine use the drug efficiently. Based on what the US FDA had pronounced and what was in the study that was published in a very prominent medical journal upon which FDA based its approval, or authorization rather, the patients in whom the drug seemed to have the most benefit were those who were over the age of 65 or those who had significant pre-existing health conditions, lung conditions, obesity, things that would predispose them to potentially need to be hospitalized. The reason why this drug is something of a, presents an interesting clinical question is you want to use it in that middle group of patients. There's a certain group of patients who are very ill. When a clinician first sees them, they're going to need to be hospitalized. The drug doesn't really work in them. There's another group of patients who are not that ill when they first go to the doctor and may never become ill. The drug doesn't work so well in them either. It's that middle group who have pre-existing conditions and for whom hospitalization may be in the cards. This is where the drug is used the best, so it can avoid that hospitalization. But predicting who that is, that's a clinical challenge.
Okay, great. And then if I could just ask a question about Thanksgiving. New York and Connecticut have issued new limits on private indoor gatherings, limiting them to just 10 people. And on the one hand, it seems understandable that they'd issued restrictions, but then on the other hand, it's still 10 people and small household gatherings are what's driving cases. So I'm just curious to get your take on those restrictions, and is Maine considering anything like that?
You know, I'll start with, oh, go ahead.
Well, I was going to say, we continue to look at all of our options for what we can be doing here in the state of Maine. I do think that enforcing restrictions in private settings is quite challenging, and we've heard that from different states that have gone down that pathway. But I will remind folks that we strive to allow as much safe activity as possible, but that does mean being vigilant about face coverings, being vigilant about that 6-foot distance, trying to limit gathering size as much as possible. So we are continuing to look at all new options, but really trying to ensure that the ones that we put into place are respected. We want to, for example, keep restaurants open, but that means we all have to do our part. So if you do go to a restaurant, you should wear your face covering unless you're eating and drinking, for example. So we are continuing to look at new options, but also trying to ensure that the options that we most recently put into place are respected.
I'm going to turn over to Morgan at WABI.
Hi, Dr. Shah, Commissioner Lambrew. Today I'm asking about the vaccination plan, and then I have a question about sports, specifically hockey. So first, we were looking at the Maine COVID-19 vaccination plan, specifically phase 2. We're wondering the critical risk workers, the workers who are both in industries essential to functioning of society and at substantially high risk of exposure. Can you be specific about who those workers are?
Mm-hmm. So generally speaking, and that's a categorization that we have used at other points as we've been grappling with COVID-19, when we've talked about critical industries, essential industries, things of that nature. Generally speaking, we utilize a list that the United States Department of Homeland Security created many months ago to help think about those categories of workers and employees that are in critical sectors, critical infrastructure. That's generally speaking who we are contemplating as being part of phase 2. That list is available. It includes who you would think it includes. It includes teachers, healthcare workers, first responders, the men and women who drive snowplows and repair our electrical lines after ice storms. Those are the folks that we're thinking about there.
The folks that were able to continue to work when we were in the lockdown setting?
That's generally right. There may be some differences as we get into the micro planning. There might be some differences at the margins, but generally speaking, who we thought of back then as quote unquote essential workers because of the vital role they played in our economy. Like I said, first responders, healthcare providers, teachers, snowplow drivers. That's who we're thinking about here.
And my next question is about youth hockey. Can you talk about what specifically happens in the sport that sport is being targeted? I won't say targeted, but that's the sport that's being delayed. What's going on in the sport of hockey that differs from other sports?
So I'll just begin and be quite clear. The community sports guidance here in Maine, as well as the Maine Principals Association guidance for school-based sports, do not distinguish hockey from basketball, field hockey, lacrosse, other moderate risk sports. And there is a definition in our guidance that is actually used by a number of states about what is moderate risk. We're not the ones who invented this categorization. And that does include sports where there's more close contact for more sustained periods of time, that there's a lot of strenuous activity, which means that those respiratory droplets are more likely to flow. And Dr. Shah can speak to this as well, but I just do want to make it perfectly clear that we only categorize sports based on how people interact in them. We're not going out of our way to single out any specific sport, just really going purely on a public health view of what those engagements entail.
Mm-hmm. And Morgan, I'll just say very briefly, I've had some conversations with colleagues at the US CDC as well as colleagues in other states on this topic to try to understand more about potential risk factors around hockey. As Commissioner noted earlier, just a couple days ago, I was having a conversation with my counterpart in New Jersey, who noted that they've had 14 outbreaks associated with hockey, not cases, but outbreaks. That prompted me to reach out and touch base with a colleague at the US CDC who specializes in infectious disease epidemiology. And although nothing has been scientifically nailed down, there are some hypotheses, and I want to stress they're just hypotheses. Some of it may have to do perhaps with the cold floor creating a temperature inversion that may affect the way that droplets hang in the air. There are different theories right now. And I don't know that any of them, I don't know which one of them will eventually have better scientific traction. But that's something that I do know that some epidemiologists at the US CDC are trying to get a better sense of.
So is that why hockey was singled out regionally by the governors?
I will just say that Governor Murphy from New Jersey, where again, the outbreaks have been significant, came to Maine. We had already announced our policy independent of that activity. We joined on because we do think that having regional approaches where possible and feasible is always a good thing. And we'll look for other opportunities to work with other New England states and Northeastern states and other states on strategies to prevent the spread of COVID-19.
Thank you both.
I'm going to turn now to Steve Betts.
Hi, thank you, Dr. Shah. There's a group formed on Facebook opposed to wearing of masks, and they've announced they're going to be having a protest, so to speak, by going through supermarkets throughout the state this weekend, not wearing a mask. What can the state do on this? I spoke to a manager of a supermarket here, and they say if someone's not wearing a mask, they ask them to. If they say, well, I can't, they don't ask any other questions and let the person go on their way. So what can the state do about this group or this practice?
Sure, and I'll just say one thing about policy and then talk about the potential activity, which is our policy does have some, but not all types of stores enforcing the face mask rule in their settings. Large stores do that, not necessarily small stores, because it's just harder for smaller stores to be doing that kind of engagement. All that said, we are aware that there are potential protests associated with face coverings happening. We respect people's right to voice their views, their own concerns, their political beliefs, and we also support peaceful protests. That said, we are concerned about protests against face masks that put store workers and their customers at risk and in danger of catching COVID-19. As such, we're working with stores, we're looking at our options because we do want to, at the end of the day, just get back to normal. We're asking people to take these common sense approaches of trying to keep apart, trying to limit gatherings, wearing face coverings to protect people so we can get back to normal. So we continue to look at what is going on out there, work with all partners to try to figure out how we can safely engage as well as safely protest.
I have a second unrelated question for Dr. Shah. There are 16 cases now on North Haven, which has a population of 600 or so. Is there an outbreak out there, or is this just community spread?
This is community transmission. Our epidemiology team is aware of this and has been working with folks to make sure testing is available, but the virus is everywhere. And this is yet another reminder of how far and wide it can reach.
Thank you.
I'm going to turn over to Eric Russell next.
Good afternoon. Thank you both. I realize that my microphone has not been able to be muted, and I apologize. I've got 2 kids at home, so this is a bit of a high wire for me. I wanted to ask a little bit. I mean, I know that, you guys are always constantly updating guidelines as things arise. Is there really anything else that can be done to sort of protect against some of these small family gatherings where we know a lot of this spread is happening? Is there anything from a policy perspective that can be done, or is it really just continued education that this is what's causing the problem?
Eric, I'll start. We're always looking at ideas that other states are exploring, and not just in practice, but even in discussions. I've mentioned numerous times how both Commissioner and I have numerous calls with our counterparts across the country to see if there are new ideas out there. But with respect, I think what's sort of happened is that one of the ways in which the pandemic has changed is early on, we were conditioned to think of a lot of the transmission occurring in large groups and large gatherings. But now that it's moved indoors, the frame of reference, the lens that we still think about transmission is associated with large gatherings. So folks are saying, well, look, I'm not going to any concerts. I'm not going to sporting events. I'm not going to any large gathering. I should be fine. But now, of course, we're seeing that that's not the case. That's one reason why I think it's important for all of us to keep talking about it so that everyone is aware that that is the primary means through which community transmission is happening. but also to couple it with what the implications of this are. I mean, we are literally now at an inflection point where the number of people who are dying every day and every week in Maine can be traced to the number of cases there are. And those cases are coming from small family gatherings. So it's more than just knowing where it's happening. For me, it's knowing what's at stake. And what's at stake right now is how we go about working as a state. That's what I really want folks to appreciate. There's a lot at stake right now, and it comes down to the choices that each and every one of us make on a day-to-day, weekend-by-weekend basis.
And a quick follow-up, if I could, for the most part, although there have been isolated cases and some small outbreaks in schools since they opened in September, we haven't seen massive spread from schools, I guess. Is that a good sign? And does it speak to some of the safety measures that have been put in place, like universal masking and distancing and other things? And would you consider the opening of schools so far to be a success, with fingers crossed?
Here's how I'll characterize it, Eric. We have seen cases of COVID-19 that have been associated with students, faculty members, and staff members at the schools. And that's, of course, that's concerning, and it's saddening. But what we have not seen in large numbers across Maine is, you use the right word, we haven't seen significant transmission within the schools. That, I think, is an encouraging or silver lining to what is which is to what is a number of cases. I think it's also important to keep in mind what the denominator is here. There are 180,000 or so school children that attend school in Maine, and the numbers of cases we've seen as a fraction of what the totals are is also encouraging. To me, that's a reason why the controls that we've talked about, the so-called and sterile term for them is engineering controls, why I think they are so important, whether it's face coverings, distancing, keeping windows open, keeping plexiglass up. I think that's a large reason for why we have not seen widespread transmission in schools. To me, that's a good thing, and all the more reason why we need to keep those things up.
Thank you.
I'm going to turn over to Amy Brown at WERU.
Thanks, Dr. Shah. Can you comment on any cases or possibly an outbreak that we're hearing about at Maine Maritime Academy, and whether or not cases at the academy and other colleges and universities around the state are being included in our totals if the students are from out of state?
Okay, so in terms of Maine Maritime Academy, we are aware of cases there. I know that my team has been working very closely with the Maine Maritime Academy and has been in communication with their leadership about some changes that they may be making, that the Maine Maritime Academy may be making to their schedule in the coming couple days. So I know that those conversations are happening. I believe that the recent number, we'll get to you the recent number of cases that they've recorded. Now, with respect to how those cases are logged, if students are claiming residency in Maine, which my understanding is that most of them do, they're absolutely counted in our numbers.
Okay, thanks. And we've had a couple of people contact us, one of them a healthcare worker, saying that there's been a shortage of one of the testing chemicals, possibly the reagent, that has resulted in a backlog for people getting test results, specifically Ellsworth Hospital, and may have even delayed some surgical procedures there in Hancock County. Is that something you're aware of? And if so, how widespread is the shortage? And then also, when people go on the website, the state's website, to look at testing sites, are the ones that are listed as swab and send sites the only ones that are using the CDC lab for processing?
As to the former question, I have heard reports that some reagents, as well as some of the materials that may be used by different hospitals for the testing platform that the hospitals have invested in, whatever type of platform that may be, that there have been some concerns around availability. We've been made aware of them from different hospital chains, and I've heard about them from colleagues in other states as well. Now, with respect to the testing, the swab and send sites do utilize the Maine CDC's laboratory, but not exclusively. We also make sure the laboratory in Augusta is available for example, facilities that may be experiencing an outbreak to be able to get widespread universal testing done in short order at, say, a long-term care facility. So there's more testing being done at the Maine CDC laboratory than just those coming from swab and send sites.
Okay, but if
Commissioner
someone
Lambrew,
oh, sorry
anything?
about that.
Yep. No, go ahead, Amy.
I was just going to say, so if somebody wanted to be sure that they were going to a place that their test was going to be run by the Maine CDC, they just need to look at that list and pick a swab and send site.
That is right. If you really wanted to make sure your specimen was being run at the Maine CDC, you by going to a swab and send site, you would be getting a test run at our gold standard laboratory in Augusta. That is not to denigrate the value of other testing modalities. A PCR test, whether it is run at another laboratory or at the Maine CDC laboratory, they all laboratories have to adhere to very exacting federal standards. So I don't want to set up a notion that our laboratory's results are somehow more reliable. I'm exceedingly proud of our laboratory, but not for a second do I want to throw even a droplet of cold water on any of the other laboratories in the state of Maine.
Right, you're not
I will
experiencing any
just-
shortages in this chemical?
I was just going to add that, but that is why, though, we set it up in the first place, these swab and sends, was because of the shortage of those reagents back in the spring. We developed a unique relationship with IDEX for those reagents. We have sufficient supply. The testing takes place here in Maine, collected here in Maine, stays in Maine. So we developed this system in part to prevent us from being at the whims of national labs where there have been some shortages of reagents. So I would just say, well, I 100% agree. The quality of our testing equals that of all other labs. We all are held to a high standard. We're proud here in Maine of the fact that we do have our own capacity that is less susceptible to what we've seen in different places.
Great.
And Amy,
thank
to
you.
round out the answer to your question, we have not, our laboratory in Augusta has not experienced any shortages of the chemicals that are used to conduct testing.
Great, perfect. Thanks.
I'm going to turn over to Charlie at the BDN.
Hi, Dr. Shah. My first question is about, actually both of my questions are about a new report that I think Maine CDC put together for, it's on the US CDC's website about the August 7th wedding outbreak. And I was wondering, could you just explain a little bit about what you see as the value of publishing this research?
Yeah, wow. You didn't miss a beat, Charlie. That just went live about an hour and a half ago. We just got notified by the US CDC 24 hours ago that they were going to be publishing it. I think the value is, Charlie, it's important to remember that even though we're in the midst of an emergency response and have been for many months, the scientific process still guides the way that we go about our work. Science remains our guiding principle. And one essential component of the scientific process is to share the learnings that we have developed in outbreaks that we've investigated. Given the large number of people affected in disparate parts of the state and the ability of our contact tracers to piece those things together to produce the picture that we now have, that to me was a reason to not only publish that so other state health departments can learn from that, but also to demonstrate what is possible through good, careful contact tracing. But really, this is what scientists do. I mean, this is fundamentally a scientific enterprise. And what scientists do is publish their scientific findings. That's what science has done for 800 years. And I'm really proud of the team at Maine CDC, who in the midst of everything else going on, were also simultaneously able to write up our findings and publish them in what in the public health and epidemiology world is the gold standard journal, the MMWR, a journal that I've referenced many times. I'm really proud of the team for doing that. Okay.
And related, just a sort of clarifying question about that report. It mentioned that the one link of the outbreak to the Somerset County nursing home that it was one of the guests of the event, according to this paper, passed the virus to one of their parents, and it says that parent was an employee of the long-term care facility. And when you originally announced that connection, I think there had been an additional remove. There was a third person who was actually the worker who caught it from the parent. Are you able to clarify those two different, that discrepancy?
I don't recall that discrepancy, Charlie, but my recollection now is that it was a guest who passed it to their, what we noted in the scientific publication is the correct, or is the most accurate rendition of events.
Okay. Thank you.
I will turn over to Patrick Whittle to close us out.
Thank you very much. My question also pertains to testing. Earlier in the week, Nordics mentioned that they were opening new testing sites where folks don't need a referral from a doctor to be able to get a PRC test, and they'll have results within 72 hours. Unlike some of the testing options we've detailed here, these are not free. They cost about $100, and they're not billable to insurance. So I guess I would like to know what are the circumstances where someone would pursue this type of testing versus the various options that are out there that appear to not carry so much of a cost burden.
Sure. I mean, I think we welcome as many different sites in Maine offering COVID-19 testing as possible. I think we still want to make sure that people have ready access, that they don't have to travel that far. Again, we think we've done a pretty good job with our swab and send sites, but some of them do have limited hours, and sometimes there are waits for appointments. So we welcome Nordex. CVS has been offering testing. Convenient MD does testing. Walgreens, as we mentioned. So there's a bunch of sites out there that do offer testing under our standing order that allows anybody symptomatic or asymptomatic to get testing, because going back to first principles, one way that we will slow the spread of COVID-19 is detection, isolation, and quarantine. So we welcome additional opening of sites for testing in the state of Maine.
Terrific. If I could ask one more quick question. Earlier in the day, the governor, who is not on this call, mentioned that service employees at stores are sometimes put in the kind of unfortunate position of being the COVID cops, where they're the ones who have to try to take steps to get the rules enforced about mask wearing. Is the state taking any kind of steps to sort of prevent putting service employees in a position where they have to sort of act as an authority that ordinarily a code officer or someone else would be taking care of?
So the truth is that there's all sorts of rules that different types of businesses do enforce for public health, for workplace safety. So we don't consider this all that different, recognizing the fact that we do continue to have people who, for various reasons, don't wear face coverings. We provided trainings, we have checklists, we have de-escalation videos that have been posted. We work with the Maine Municipal Association on other types of local activity to give all those stores, retail establishments, lodging, the tools that they need to be able to help us in this basic public health. Because again, our goal is to protect their customers, to protect their workers, and we see this kind of partnership in so doing valuable.
Great.
Great. Thanks, Patrick. And that was the last question for the afternoon. And so to round us out, I'd just like to close on this note. As we've talked about now for a while, COVID-19 cases are rising all across the state, in every county, in every town, in every municipality, not only just geographically, but in every walk of life. We are starting to see cases, and have been seeing cases now, affecting different types of workers, different types of homes, different ages. Just about anyone who now can be infected is starting to be infected. And as a result of that, today's community transmission can turn into tomorrow's outbreaks. There is so much at stake for where we are right now with respect to this outbreak. Now more than ever, it is really critical that everyone do the basic things that we've talked about to lower the risk of transmission, be that wearing a face covering and keeping 6 feet apart, as well as all the background things, like keeping good hygiene in place and making sure that if you've got symptoms, you stay home. Now it is more important than ever to do those things. So I'd like to close on that note. As always, please be kind, take care of one another. We will talk again tomorrow.